Welcome. We're very, very happy to have you all here. My name is Tonia Wellens. My pronouns are she, her, hers, and I am the president and CEO of the Greater Washington Community Foundation. Today, I am incredibly honored to welcome you to the fourth in our series of social justice town halls, which are presented by Wells Fargo. I want to take a moment to acknowledge Wells Fargo for their generous sponsorship of this town hall series. Their support allows us to offer this space to discuss issues that impact our community and the concrete actions we can take to build a more just region. Thank you so much. So earlier this summer, the Community Foundation released our VoicesDMV report, our Community Insights survey, which was conducted by Gallup in early 2020. And our objective was to really understand or put a finger on the pulse of the issues that are facing our region. We heard from more than 1,600 residents across DC, suburban Maryland, and Northern Virginia on the issues that matter most to many in our community. And we were so proud of this survey, and we were able to, again, work with our partner Gallup to collect statistically significant regional sample of self-identified LGBTQ survey responses. What we found is that across many of our survey areas, LGBTQ plus folk experiences of living in the DMV region, they're very different from those that are non-LGBTQ. Alarmingly, LGBTQ plus survey respondents were 3.5 times more likely to have experienced discrimination on a daily basis versus our non-LGBTQ plus responses. One of the main areas where LGBTQ plus attitudes and perceptions diverged was around the topic of employment. Our neighbors, our LGBTQ plus neighbors, were 1.5 times as likely to say that they have experienced discrimination during job search as compared to non-LGBTQ plus respondents. My apologies. It is ironic that at the height of the unemployment spike earlier this summer that left thousands of LGBTQ plus workers in our region out of work, the Supreme Court finally determined that for our nation, what many of us already knew, that the choice of who we love shouldn't factor into whether you can make a living. With the Bostock-Clayton County ruling, the court found that employment rights for the LGBTQ plus community were covered by the 1964 Civil Rights Act that bans discrimination in employment based on race, religion, national origin, or sex. However, the pandemic continued to disrupt our lives. Unemployment spikes, especially in industries with a larger than average share of LGBTQ plus workers, namely the restaurant, retail, and hospitality industries. For our LGBTQ plus neighbors of color, especially, the disproportionate impact of COVID-19 and unemployment have hit incredibly hard. So what does this mean, and where do we go from here? Economic security is key to well-being. And today we will hear from regional and national leaders on how we can work to ensure that the LGBTQ plus community is able to live and thrive in our region during and after this pandemic. Very excited that we have an amazing panel who will offer some insights on these topics, and then we'll have an opportunity for Q&A with the audience. I'll turn it over to Ben Murphy, my colleague, to introduce our panel.
Thank you, Tonia, and thank you to all of our fabulous panelists. And I also just want to say thank you, Tonia, for agreeing to sort of this airtime for LGBTQ plus issues in this social justice town hall series. I think it's a really important conversation to have, and are very gratified that we're able to pull this together today. So before we dive into the topic of employment equity, it's really important to provide some framing information on the disproportionate impact that COVID-19 has had and is continuing to have on our LGBTQ plus neighbors. So to get us started, I'm really happy to be able to invite Dr. Laura Durso with the Whitman Walker Institute here to help to frame this up and give us a little bit of data on really what is the impact on the LGBTQ community, what are the challenges some of them are facing right now. So Dr. Durso, if you're comfortable sharing your pronouns and introducing yourself, we'd love to hear a little bit more from you.
Thank you, Ben. Thank you all so much. With huge thanks to the Foundation for inviting me to join this incredible panel to talk at a difficult moment in time. Again, my name is Laura Durso. I use she and her pronouns, and I'm the Executive Director and the Chief Learning Officer of the Whitman Walker Institute, which is the research, policy, and education arm of Whitman Walker Health, a federally qualified health center here in DC. And like I said, I just wanted to start by recognizing and then naming the moment that we are in. I want to recognize that we're having this conversation at a time when the pain of racism and vast inequality is particularly acute, and when there is widespread mistrust of institutions and genuine fears for the health of our democracy. So I'm really, really grateful for your time and your interest in joining us for this discussion, and for engaging with us in ideas for how multiple different systems can and really should address multiple forms of oppression to aid our local communities and certainly our country at large. So I want to start in sort of this landscape overview by saying that I think the key to understanding the impact of COVID-19 on LGBTQ people is to really understand what life was like for LGBTQ people before the pandemic. We have really clear evidence of discrimination across all areas of life for LGBTQ people. If you look just within the report that was released from VoicesDMV, 55% of LGBTQ respondents said that they'd been discriminated against in the past year. That's 1 in 2 people. That's more than 1 in 2 people. And 7% said that discrimination was a daily occurrence. This is a real pernicious and lived problem across all areas of life. So we have clear evidence of discrimination in all areas of life. We also have really clear evidence of economic insecurity for LGBTQ people, which I think is something that is fortunately starting to break through, but has really been a myth about queer and trans communities. There's this sort of myth of the affluent gay person living in a coastal city, and that's really, really not the case for the community. We have growing evidence of a greater vulnerability to poverty. Our community is more likely to report receiving public benefits like SNAP, nutrition assistance, or Medicaid. And that's particularly true for LGBTQ folks of color and people with disabilities. I went back to look at the US Trans Survey, which is one of the largest samples of transgender people and non-binary people collected. In 2015, 12% of their respondents reported an annual household income below $10,000. 12% said there was less than $10,000 a year in their household. That figure rises to 19% for Black respondents, 18% for Latinx respondents, 16% for Native American respondents, 15% of Asian respondents. You get the idea. Folks of color in the trans community are really showcasing the deep economic instability of the community, again, before the pandemic even began. So we have clear evidence of discrimination in all areas of life, of economic insecurity, and for us at Whitman Walker in particular, focusing on healthcare, we have clear evidence of really reduced access to things like health insurance coverage, significant health inequities relative to non-LGBTQ peers. If you think back to before the Affordable Care Act went into effect back in 2013, 1 in 3 low and middle income LGBTQ people was uninsured. And we've made some progress in that area, but we're still roughly twice as likely to be uninsured. There's plenty of evidence of poor mental and physical health outcomes. We tend to have reduced utilization of important things like preventative screenings and are at increased risk for things like cardiovascular disease and certain cancers. So this was the picture pre-pandemic. So if you think about then the pandemic happening, the impact of the pandemic is both broad and really deep. I have a hard time thinking about an area of life that is not impacted by the pandemic for LGBTQ people. And it's really not just about healthcare and jobs, although those are certainly central to this discussion. But think about a student who is living at home in an unsupportive environment who now can't go back to the safety of their on-campus life. Renters who can't afford to pay their landlords and maybe face eviction from their homes. Workers who can't take paid leave to care for family members, particularly chosen family members who may not be related to them by blood or legal ties. or even if you think at a very broad level about the long-term impact of a bad census count, which is going on right now, and I encourage everyone to go complete your census if you haven't. But if we have a bad census count, that's going to be partially because of the pandemic and the challenges we're facing in actually administering that count, but it's also about policy choices that are meant to reduce access to power. So all of these things are combining for a fairly bleak picture of the impact on LGBTQ communities. So that's sort of the landscape. If we dig down a little bit into thinking about who has been bearing the burden of that high risk of infection and death, it also really becomes clear how likely it is that LGBTQ communities are going to be and are continuously being hit hard by the pandemic. If you look at the demographics of LGBTQ populations broadly, LGBTQ people are more likely to be women, to be younger, to be people of color. And at least the data that we have clearly showed the disproportionate negative impact on Black and Latinx folks, on Indigenous people when it comes to COVID infections and death rates. It's a very startling and heartbreaking picture. If you look at the job losses that we've experienced in this economy and really the slowness of the recovery, those things have been more acute for, say, women compared to men. Some of the job losses have been particularly extreme for folks at the low income end of the spectrum, which is where we know LGBTQ people disproportionately lie. There's some difficult data from Raj Chetty out of Harvard that found by April, so really early in the pandemic, the bottom quarter of wage earners had lost almost 11 million jobs. That was 3 times the number of folks at the top. And they looked ahead and by June, 80% of the jobs that are still missing are in the bottom half of workers. It's almost like we have seen a recovery for people who are at the top, and everyone at the bottom is waiting for a solution from our governments and our systems. So that's contributing to the negative impact on LGBTQ folks. And I'll add that if you look not only at who LGBTQ people are, but where they are, and if you look at settings where infection and death are really highly concentrated, so congregate settings for older adults, detention or correctional facilities. These are also settings where LGBTQ people are overrepresented in the population. That's particularly true for incarcerated people. And so we are who is getting impacted, infected, dying, and we are in places where more people are facing illness and death. So it's a difficult picture, and I know today we're going to talk about how we address that. I wanted to sort of end my opening comments on sort of highlighting how important data have been to seeing how our systems are set up, to see how they fail Black and Brown communities, how they fail LGBTQ communities, and how they can create accountability for people in power. This is why research on LGBTQ communities is so vital, why the work that the foundation is doing to shine light on these issues is so important. We have some data on LGBTQ communities and the direct impact of COVID. We see increases in depression and anxiety, particularly among people who weren't experiencing depression and anxiety before the pandemic. So we're worsening those mental health inequities. The Human Rights Campaign Foundation put out some numbers around economic security. Their April survey showed that 30% of LGBTQ people have had their work hours reduced, and that's compared to 22% of the general population. LGBTQ folks were also more likely to have taken unpaid leave from their jobs, and the LGBTQ folks of color were particularly strained within this survey. They were more likely to have asked for delays in paying bills, or twice as likely as the general population to have asked for a delay in paying rent. And so I want to put on the table that continued study of these issues is vital in order for us to know how to act, right? How to guide the public health and economic responses to the pandemic. So I know, and I'll end with the idea that also that I know our discussion today is focused particularly on economic security, on employment, and on the workplace. And my hope is that the pandemic has really demonstrated how inextricably linked our physical, mental, and economic health are at both the individual and the systems levels. So it's imperative, right, that responses to the pandemic are then comprehensive, that they're targeted to meet the real world needs of diverse populations, and that they're backed up by laws and policies that provide real accountability. At the top, we talked about the Supreme Court's recent decision this past term confirming that LGBTQ people are protected under federal employment law. We celebrated that. It also, we have to acknowledge, didn't magically restore the employer-sponsored insurance coverage that a trans worker lost when she lost her job due to the pandemic. And so this validation from the court is certainly a part of the necessary framework to, ensure that the government is a partner in serving our communities, not a hindrance to good health and full equality, but it's really only one piece of the puzzle. So I want to stop there, and I really look forward to further discussion and to answering questions from folks in our audience today. So thank you.
Excellent. Thank you, Dr. Drisso. Really appreciate you. Wow, that's a lot of very sobering data that you're able to offer to us about not just the impact on LGBTQ people, but LGBTQ people of color and the intersectionality there. So I'm looking forward to talking a little bit more about this as we go on. So next we're going to pivot and I'm going to invite my good friend and a colleague, Sultan Shakir, who's the executive director at SMILE, a fantastic nonprofit that's been working on behalf of the region's LGBTQ community for decades, to talk a little bit about yourself, Sultan, if you wouldn't mind introducing yourself, sharing your pronouns if you'd like to, and the work that SMILE is currently leading around employment.
Sure. So thank you, Ben. So my name is Sultan Shakir. I use he, him pronouns, and as Ben said, I'm the executive director of an organization called SMILE, which works with LGBTQ youth in DC, Maryland, and also Virginia. And also with most things being virtual, we're actually seeing an increased number of engagement from youth across the country. And so in context of our employment work, SMILE offers some of the most comprehensive services for LGBTQ youth. We work in schools to make schools safer and more affirming, to offering programs for youth who are disconnected from traditional services, including being disconnected or pushed out of employment to discrimination. And as we've heard, during COVID, we've seen a lot more LGBTQ people, particularly young people, lose their job and become unemployed or underemployed, which has put a greater strain, particularly on a lot of Black and brown people who are also dealing with other intersectional challenges like police brutality or social isolation. And so what our programs really try to do is help young people overcome the barriers, but we also try to work to dismantle those barriers. And even with all of that work, we're in a crisis right now, as we all know, which is why for us, it's more important than ever that we work with partners like Whitman Walker or even other housing providers, given the number of unemployed people who then end up dealing with housing insecurity, which is why we work with the Wanda Austin Foundation and other partners. But also, I am really appreciative of the Greater Washington Community Foundation for the $35,000 grant, which helped us launch our COVID Relief Fund, which we were able to leverage to give out more than $75,000 to LGBTQ youth who are really struggling under COVID due to this lack of employment and job access. So thank you for that. And so with employment, I actually want to introduce an amazing young Black non-binary trans woman named Harmony who participates in our programs. So hello, Harmony.
Yeah. Hello, everyone. Thank you.
And so, Harmony, do you want to introduce yourself, please, and share your pronouns?
My name is Harmony Giovanni. My pronouns are he and she. I live currently in DC. I am working with the SMILE program. I'm also currently residing with the program as well due to home insecurity and things like that. So yeah, that's a little bit about who I am right now. So.
All right, thanks. And so Harmony, the last time we spoke, you shared about a recent experience with discrimination in the workplace. Can you talk about that, please?
Yes, so there was a recent discrimination point that happened to me in my place of work where my ID is changed to the current name that I have, which is Harmony, but my middle name is Jubilee as well. So it's like a whole huge, big, extravagant picture there. So I'm Harmony Jubilee Giovanni. And so when people meet me, I usually, present myself as a male at this current time due to some circumstances. So when I was employed, pretty much they only knew me as Harmony. But then there was at some point where I had to, of course, reveal my ID, and in my ID, I have a non-binary X there, so it doesn't really specify my gender. So that kind of gave an idea like, oh, okay, this person is definitely trans or something that we can't fully identify. So in the recent incident, it was like me having a conversation with one of the dispatch employees, and I was just like, I realized basically that you call me he a lot, and so I was just like, I actually would just prefer that you just call me Harmony. That works best for me. You don't have to call me sir, just call me Harmony. That flows with me. And then the response was kind of like, okay. But then every time I kept, showing up, whether speaking to them about work or just like anytime I had to just communicate, there was always like, okay, sir, thank you, like just consistently overrunning my preference. So that's just a small example of like some of the things that as a non-binary person or just as a trans person, like, I've gone through as far as just like, okay, I'm presenting one way and then I might clarify that presentation. And I try to make it as simple as possible because some people, they really don't understand the he and she or the they and them. And I get that because we're still growing in that understanding or that evolution of how to identify with people's gender pronouns. But I think that my name is the most simplest way for you to understand who I am. I mean, I am Harmony. So, I mean, that's simple to me. So that's why I said, just call me Harmony. So, yeah.
All right, that is simple. But you're right, like it's not something that a lot of people are grasping, which poses challenges. And what you talked about has also happened before. When we first met, you were talking about another experience in the hospitality industry where you weren't getting the right uniform that met your gender identity or expression. Can you talk about that experience, but also more like how it made you feel in terms of, just being in that space?
Yes. So currently, past working for the hospitality industry, I think that the industry is actually, clearly it's a growing industry. It's a needed industry because it is hospitable, and a lot of people go through those systems, when you're making a hotel reservation or you have a conference there. So I expected it to be a place of great acceptance for me, especially being non-binary trans, because I feel like clearly there has to be some kind of trans identifying person or non-binary person that has to one day book a room through here or have an event there. But it wasn't always so welcoming. So I had an incident where my uniform, they gave out like several versions. Well, there was only like about 3 or 4 copies of the same uniform, and so you can switch through them vicariously during the week. But I noticed that I was the only one that only had one set of uniforms. So it was kind of crazy because everyone in the staff had several uniforms. I only had one. So I had brought it to my manager's attention. Hey, I only have one uniform. I'm only washing this uniform, getting it dry cleaned once a week. And I think that it would be better, comfortable for me to have more than one. So if I have a really sweaty day, I can be able to change from my uniform. And so the comment was, okay, we'll make sure you get a uniform. And they never made sure that it happened. And so it became a very emotional thing for me because when I got employed, the security that they gave me, or the idea that I would be in a comfortable place, was very, very high. Like, oh yeah, because I told them my previous employer was not as LGBT friendly or inclusive like I preferred or what I enjoyed. So they were like, okay, sure, yeah, well, definitely. We are LGBT friendly. We want you to come. We want you, to be employed. You have some experience. You seem like you're a great person, et cetera, et cetera. Now, this is the thing. When I told them about my LGBT, me being part of the LGBT, I never specify which part am I in the LGBT. So I never told them I was transgender. But what happened was, in that process, I had got my name legally changed. So when that got pretty much legally changed, there was a lot of like, oh, like, how do you go from such a strong male name to such a feminine name? And then it became this big kind of like slow but noticeable like microaggression amongst a lot of the management, like, oh, okay, like, and then like the staff like talking about me, and then I'm hearing about it like, oh, like when I walk away out of the space, like people being like, Harmony is transgender. Like, that's not something that you just have a conversation openly without me being present, so I can help you specify exactly who I am or how I present myself. So it brought a lot of friction.
Yeah. And Harmony, so the thing about that story is I think if someone heard it, they would say, oh, well, Harmony just didn't get a uniform. But I think in the context of the other things that you were talking about, it's like there are other things happening, like people talking about you being trans behind your back. There was the story about the photo of you being like left out. Like it's more about the full picture of how you were treated and the difference between how people treat you in the workplace and other coworkers. And can you just talk about that and sort of like paint the picture of like what that's like, particularly being in that space and seeing those microaggressions happen, but still having them all in context of you being trans?
Right. It is very, it can cause a lot of trauma. It caused a lot of trauma for me. It caused a lot of anxiety for me because being from a place where I'm not so accepted from my family, I'm in the place where, okay, I need to be able to provide for myself financially, you know, drive a car, have a home. Also, I live in an expensive city that is growing in expenses every day. So being stable is mandatory. It's not an option. And then also going through a transition itself has expenses, and it also has, it just takes time to go through that experience. And so going through all of that, it was like, okay, my job is kind of like my baby. This is kind of like my standing. This is what I stand on to continue to grow into the adult that I'm looking to be, or I'm growing to just become. And so it was just very traumatic for me, because it was like, okay, I'm coming to work, I'm doing the things which I'm required to do. I'm coming appropriately. I have a positive attitude, and you know, working for the hospitality industry, being positive is really huge. So when you're coming with all of these expectations and you're fulfilling them, but yet you're being treated opposite of those expectations, it is very, very, it just caused a lot of anxiety for me. Like you mentioned about the photo, like one day, so how it works in the hospitality industry, there's always a plan. Whenever they plan to take photos of the building or any type of photos, they always have to plan that out because it's a business, it's a corporation. So it was a day that I so happenly, which my manager did purposely, I believe, gave me the day off. So everyone else is clearly at the, you know, everyone else is working except for me. So when the photographer comes, there's this like picture that is taken that I'm not a part of. So when I return to the office, when I do come to work, I noticed that there's this huge picture, and it's everyone in the front desk staff there, and I'm not a part of that. And it's just like, it was just very shocking, and it was actually kind of humiliating, actually, because it's like, how am I a part of this team? Not only that, I do, like, my work speaks for itself. I mean, I have guests that wrote emails to the GM. I've really had like a great name with the customers, but that was continuously rejected or refused or like rebutted just because I identify as a transgender person. And it was just really crazy.
Yeah. That does sound crazy, particularly when I'm sure you do provide a lot of great customer service. Like, I would love to interact with you.
Yes.
So. And Harmony,
like, I mean, I have people crying like, oh my gosh, Harmony, I haven't seen you in like a few weeks or a few months. And it's like, because that I'm just a warm person and I really do care about what I do.
And Harmony, if you had a recommendation for employers to become more welcoming, both in terms of policies, but also practice, like, what would you say?
I think definitely starting with the pronouns is a really huge milestone. And it's a milestone because a lot of people, despite their name, that's how it might sound, masculine or feminine, they actually a lot of times identify sometimes different from that name. So just finding out, you know, do you have a preferred pronoun makes you feel comfortable, actually makes your heart kind of at ease. Like whenever I go to an interview or someone is speaking, they're like, hey, do you have a preferred pronoun? It's like, oh, wow, actually someone actually cares besides the average. That's just not the average norm. And then it's like, okay, so if I can get you to at least understand the pronoun or say the pronoun, then I know that it can definitely grow into you understanding the fuller picture of who I am or what I might represent. So that is definitely a
Harmony, I also really want to thank you for sharing your experience, particularly being willing to sort of talk about some of these things that are traumatizing, because obviously, you know, thinking back to and even talking about traumatic experiences can be re-traumatizing. So thank you for being willing to share today.
Well, thank you all so much for the opportunity.
Of course. And so when Smile looks at our employment work, and really all of our work, what we really try to do is have conversations with young people like Harmony to really understand like what are the experiences, because if we're going to overcome the barriers and really dismantle the barriers, we have to know what they are. And so when we think about employment and how to really work on dealing with what the evidence shows is a big employment gap, particularly with young trans people, the first thing that we talk about is definitely skills and providing skills and job training. But the key to that work is ensuring that that work is done in a culturally competent way. So one, like asking pronouns, which is why, you know, thank you, Tonya, for opening up talking about pronouns. Thank you, Ben, for talking about pronouns. If a young person is in a space that, like Harmony is talking about, that doesn't show from the beginning that you care and that you get me, it's much harder for a young person to really want to stay and deal with the other challenges that they're going to deal with moving forward. But it's also being really clear about like what's happening in the culture. And so if there's a big win in the community and there are a whole bunch of young queer people who are in the room, like when Pose first started, like really celebrating that, taking a moment to celebrate the fact that there are so many amazing trans people who are on screen playing trans people for the first time. Or if unfortunately there's a Black trans woman who is murdered, taking time out to acknowledge that and not expecting someone to kind of come into a space and really separate everything else that's happening in their identity from the work that they're doing on a day-to-day basis. And that's why with employment programming, we see so many young trans people even just leave the program because the program is not really sensitive to who they are and the culture that's happening around them. The second part is really social support. And the key to that is having someone that you can call and say, look, I was in the workplace today, or I was in this program and I got misgendered, and having someone get it is key without having to explain what being misgendered is, without having to explain why that hurts. Having other people that you know are going through the same thing with you also really helps someone's ability to say, I'm going to stick with this because I have other people who are going through this with me. And then the third thing, which is actually more important, is really dismantling the barriers that exist for young people in employment, particularly young queer and trans people. And it's really about turning the policy into practice. And so what I mean by that is DC has one of the highest populations of LGBTQ people in the country and almost all the non-discrimination laws that you can ask for. But we still see a really high rate of discrimination in practice. And so, for example, the DC Office of Human Rights found that almost 50% of employers appear to prefer a cis candidate over a trans candidate. And so they did it similar to studies where Tanisha sends in her resume and Stacy sends in the exact same resume, but Tanisha never gets an interview because people assume she's Black. And the same thing happens with discrimination against trans people. And there's studies, even here in DC, that show that, and we're supposed to be one of the most progressive cities in the country. So if we're not ensuring that employers are shifting their spaces to turn those non-discrimination policies into practice, then really no amount of job training is going to make a difference. And so what we mean by turning policy into practice is, like we were talking about with pronouns, and like Harmony mentioned, teaching people how to use pronouns like they, them, theirs in a sentence, or ensuring they know the importance of even asking about that. Ensuring that hiring managers and supervisors are trained on LGBTQ and particularly trans cultural competency. Because just like it shouldn't be the job of a Black person to train their coworkers on what it means to be anti-racist, it's not the job of an employee to train their coworker or their supervisor while they're also doing that in a hostile work environment. And so the next is really ensuring that employers hold employees accountable for discrimination, both the blatant discrimination, but also the subtle discrimination. Because if employees are able to continue doing things that don't create a truly welcoming environment, then trans people will continue to be pushed out or feel a need to leave the workplace. And so that work, particularly with Black trans youth, when you're looking at someone's whole identity, if you were Tanisha and you were indicating that you were also trans, you were behind from the moment you put your resume in and hit send on that. And that's why we really need to work with not only the training part for young people, not only the social support for young people, but also really shifting the employment landscape so when young people finally enter the workplace, it's welcoming and affirming. And that's why we are also incredibly appreciative of the support of people like Robert, who's also here from Citi, because they definitely understand the need to support people intersectionally and the challenges and solutions that LGBTQ people are facing and need. Because we need outside pressure on companies like organizations like Smile and others are working on, but we also need leaders on the inside. And so I just want to thank Robert and Citi for your support of the work Smile does for young people. I want to thank Tonya for inviting me to speak, Harmony for sharing your story. And with that, I will turn it back over to Tonya.
Yeah, I think I'm going to take it here for just a second, just to introduce Robert Sultan, and you pretty much did my job for me. So I just want to introduce it and bring on Robert Burns from Citi, who has been a longtime funding partner here in our region to the LGBTQ plus community. I'll also note that the Community Foundation has worked over the past year on an important project to gauge the level of investment in LGBTQ plus nonprofits in our region. And unfortunately, what our findings are showing is an ongoing dramatic underinvestment in the community on the part of donors and philanthropists in our region. So I'm really excited to hear more from Robert about your philosophy behind support for the LGBTQ community as a funder. So if you could introduce yourself, including your pronouns if you'd like, and why it's important for Citi and other donors and funders to resource this community. We'd love to hear it.
Great. No, thank you, Ben. And I just want to say thank you. And it's great to be with such tremendous panelists today. But I first want to thank Harmony, especially for sharing the story, your real personal story. Very appreciative and bold, and it takes courage to do that. So much appreciated, but it also amplifies the reason that we fund. I did he, him, his. And from something Laura said earlier, I want to give the same encouragement. If you haven't filled out your census, do it. And then coming up in November, please make every effort to vote in whatever capacity you can. I think both of those from a civic perspective are just incredibly important right now. The thing I would like to talk about is from a Citi perspective as a company. Citi's long had an appreciation for diversity, and it's really spanned multiple decades. We're an international company, and we have a lot of employee networks around the world. And one of the first for us was our queer network, which spans globally, but we also have that included among our Black and Asian affinity networks. And for us, it's been really critical that we have allies throughout the bank to understand the importance of the network and to join these networks so that they're also having that intersectionality and identification of multiple identities in those groups, and really appreciating the rich mosaic that we have among our employee base. LGBTQ plus inclusion at Citi has really advanced significantly in the US, where we have our largest employee presence. And we continue not to only expand the number of Pride networks that we have, but we also publicly advocate for LGBTQ plus rights across the country. I'm proud to say that as a gay man that we've joined with a number of national and local LGBTQ plus groups across the country. And 4 times we've submitted amicus briefs to the Supreme Court in cases involving marriage equality, equal access to services for the LGBTQ plus community. And I know not every corporation can say that. So we do take, and I personally take a lot of pride in that. And one of the reasons that we are a proud supporter of Smile is something that Harmony actually brought up, which is the real issue, not only in the Washington, D.C. region, but nationally, of housing insecurity. And given the challenges around affordability, but also provision of homes, is a really critical issue. And for Citi, affordable housing has consistently been an area for us that intersects with the LGBTQ community as a whole. For example, we partner with a group out of New York called SAGE in looking at how to secure housing for LGBTQ plus individuals that are seniors, and how do you cope with the aging within the community itself. And we've promoted their model of supportive housing through a national model that they have. We also work with True Colors United, which is a national nonprofit that was founded by Cyndi Lauper. And they're looking at housing challenges that disproportionately impact this community. And with our support, they've been working to increase access to safe and affordable housing across the country. And as we looked at True Colors work and the needs here in the district, we also saw the need for housing for LGBTQ youth that were experiencing this issue of housing insecurity. And that was the reason we did a lot of work with Smile to really examine what they were working on. And it was clear under Sultan's leadership and that of the board, they were looking to grow that work significantly here in DC, given the needs. And we were proud to provide a grant to have that work take place. And there's tremendous challenges that the youth face when it comes to safe and affordable housing. And you can't separate housing and employment, because if you can imagine the linkage between the two, how that would impact a person's ability to sustain employment if you don't have access to secure housing or a place that you know you're going to be able to go home to every night. One of the things that we did when COVID took root, we reached out to each of our partners, including Smile, and had a conversation, often either over email or the phone, to ask, would it be helpful if we allowed you to unrestrict your grant to be able to adapt to the needs that COVID had faced for the organization? And I think Sultan immediately said yes, as did most of our partners. And we were happy to do that because we realized housing was absolutely important, but there were needs coming up for Smile and other nonprofits across the region. And therefore, we felt it was important to unrestrict those funds to allow Smile to adapt to the needs that the organization was facing. I wanted to say that because I think as funders, it's important that we do our best to empathize with the organizations and our partners that we work with, and try to make sure that we can adapt as much as we can to meet their needs as a funder and work as a true local partner, which is something I'm proud that we're able to do. Appreciate the opportunity today, and Benton, I'll pass it back to you.
Thank you, Robert, and I really appreciate all the great content you're providing here, just in terms of how, from a funding perspective, you are thinking about the intersectionality of all these issues. As we've worked to do more in this LGBTQ space, I'll just say that that's a lens that we're increasingly trying to take in our investments, and I'm really proud to report that through our COVID fund, we were able to provide at least 5 queer-led and serving organizations with great COVID relief grants, including Smiles, which we got a shout out for earlier. So really proud of the Community Foundation and the way that we're showing up here, and hoping to follow on the footsteps of many other great foundations like yours. So I'm going to turn this over to Tonya, who's been here with us, and she's going to be helping to facilitate our last section of the conversation here, which is a focus on questions and answers. So Tonya, take it away.
Great. I echo your thanks, Ben, to our panelists for providing such useful insights and learning opportunities for all of us. Dr. Dorso, I appreciate your big picture framing, along with the notions around the intersectionality of so many of the issues that we're talking about and dealing with today. Sultan, I really appreciate the nuanced way that you helped us to better understand what's happening, how you're working with your clients on the preparation side, but also the work that we need to do on the other side, which is the corporate side, which Robert also represents. And Harmony, really appreciate the sort of the behind the story details about your background, your experience, and your life. I just appreciate, again, just being able to participate in and learn from this important and nuanced conversation. I'd like to direct the first question, and I want to invite those of you who are on the call, on the line, on the screen, to add a question in. If you want to, direct anything to any of our panelists, but I'll just start by directing the first question to Sultan about the impact that you've seen the LGBTQ community experience through COVID-19. I know that you raised the fund. Could you just talk to us a little bit about the kinds of things that you were able to use the fund to respond to?
Sure. So when you talk about COVID-19, like to kind of put the COVID-19 into context of the work, one of the most powerful things that Smile has been able to create, and this is not just me, this is the staff and the board and the volunteers and the youth, but like the organization as a whole, is a sense of community. And one thing that we found is through a number of studies that when young people, particularly queer young people who are feeling isolated, are able to come to a space and just see that there are other caring people, kind of like that social support I talked about earlier, it helps increase other things like their interest in going to school and their belief that they can, meet their career goals or whatever it is that they're trying to do. The challenge that COVID created for all of us is it took away that ability to come together for community. And so then we saw a lot of young people who were at homes that were not supportive, everything from young people who just didn't have the ability to get out of the house because they were in high school and they were being asked to stay home early on, or young people who were away at college and were counting on the ability to be in their dorm, and then they would have to go back home. And so what it did really for all of us, but I think it had more of an effect on young people and even more of an effect on young queer people and young queer people of color, is took away their ability to go and find other people and connect with that got them. And so that created a lot of trauma, it created a lot of stress. And then when you add the employment challenge on it, there were just questions about how to operate in the world under COVID. And so what we ended up seeing with that is it was money for everything from, I am in DC right now, but I don't have a job and I can't afford to live here. So I need to get money to go to another location and, stay with a friend, whether it's, in the South or in the West or someplace outside of DC. It was, I lost my job and my parents lost their job. And so we just don't have money to eat. It was, I am trying to get into an educational program and I can't afford that. And so I need the money for that. So we saw almost everything come across the table in terms of what COVID's impact was and what people needed, because so many different supports were taken away from people, particularly the ability to come together and try to solve problems as a community.
Thank you. I appreciate, again, the nuance is so important to deepening our understanding. Robert, who I want to share is a really good personal friend of mine. I wonder if you wouldn't mind talking a little bit about what other companies might consider. I think it's amazing that Citi has been so sort of out there when it comes to taking public policy positions, and you might share that this is something that companies can and should do as part of your corporate social responsibility, but also just part of your responsibility as a member of the community. Would you mind speaking to that a bit, Robert?
No, appreciate it, Tanya. And I want to give a shout out to Tanya as well and her role and her leadership here locally. Appreciate it as a friend and a colleague on the philanthropic side. I do think there's a real role for corporations, and I see more and more companies stepping forward, whether it be around their work in environmental, social, and governance, the ESG work, or folks looking at corporate social responsibility, or a number of companies in which Citi was part of to step forward and talk about it's more than just the bottom line. It is about the impact on community and the impact on civics and the impact on people. We have a tremendous role within the community, our employees, our customers, and everyone else. And certainly we have a voice with thousands of employees across the US. And I'm proud when we lift that up, and I'm encouraged to see more companies stepping forward. One of the things that I think is important now is certainly companies addressing racial equity, and equity fits in this much larger framework. I am proud that yesterday we announced a $1 billion commitment devoted to racial equity across the corporation at Citi. Much more to follow on that, but I think this discussion, when it comes to equity, fits well within that framework. And I do think it touches on something you said, Tanya, which is around corporate leadership and how do we exercise that, and what does it look like, and how does a corporation exert empathy, which is something I think everybody needs to consistently remind themselves of, is what is it like to walk in.
I think we lost your last sentence, Robert. You have no sound now. Oh, there you are. Just please, I want to give you the opportunity to finish your last statement.
No, thank you. I'm just saying, I think empathy is just incredibly important in what it's like to be in someone else's shoes and to always remind ourselves of that. But thank you for giving me that opportunity to finish.
Thank you. I appreciate it. And I agree with you on this notion of empathy. It's what we need now more than ever. Dr. Dorso, I want to give you an opportunity. I'm mindful of the time. If there are any things that you want to offer, particularly on the intersectionality of issues, particularly you raised around economic well-being, but also mental health. I just wanted to create the opportunity for you to have a few words.
Thank you. It's been an incredible panel. I want to add my thanks to you, Harmony, for bringing your lived experience to the table. I think one of the things that I've heard from all of us is that there is a real difference between legal equality and lived equality. I spend a lot of my work life thinking about that legal equality piece, but also trying to talk with folks about people who may not have as much of a familiarity with LGBTQ issues. How can I bring them into the conversation and build up a sense of urgency about meeting the needs of the community? And that has many, many challenges, as folks have talked about today. So I really want to come back to something, Harmony, that you were talking about in outlining your experiences, which is a thing that I think audiences who may be less familiar with these issues do need to hear, which is I think it's easier, not always easy, but easier for people to connect with the idea of somebody getting fired is a problem. Right, like we've actually had majority support for at least gays and lesbians having employment non-discrimination since the 70s. So this isn't a new idea. People sort of understand intuitively that getting fired is a bad thing. Where we have really not been able to bring people in the same degree is what are those small but deeply wounding indignities in a workplace context, the misgendering, the not being in the photo. Those things add up. They get under the skin. We can very clearly point to how these things cause illness and death. And those are the things that we're really trying to work on. I am here thanks to the tireless work of generations of queer and trans leaders. I have a lot of privilege that I can bring to the table and have these conversations with policymakers to say, that there really is this lag that happens between the legal equality and the lived equality. And there's research evidence to say it actually almost doesn't matter what the law is, but it's that workplace culture. And it is about getting folks to see it's not just this, the baseline is not we're not gonna fire you, we're not gonna kill you. Like folks have been fighting for their basic recognition of humanity for so long, and we really have to get to this point of active embrace of the community and targeting specific needs of the community. It matters that health insurance companies provide healthcare for trans folks that meets their needs. Those needs are different across trans communities, within trans communities, between trans communities and non-trans communities, but those needs are medically necessary. They make people healthy and whole. They allow them to engage with their communities, whatever those look like. And so it is meaningful from a policy perspective. We have to have those baseline things that people acknowledge that there are unique needs that need to be met. We have to do it from a policy perspective, and all of us have a responsibility to be actually actively creating a world that supports all of us on the basis of our sexual orientation, gender identity, gender expression. And that's how we gotta shorten that lag time between that legal equality and that lived equality.
Absolutely. There's a comment in the chat box that's agreeing with you around aligning the practice with the policy. Harmony, do you want to have a last word? We've been calling your name consistently for the last hour.
Yes. Once again, I'm just very thankful and grateful just for the opportunity and to be a proxy, and that my story is not in vain, and that it has, and that I've turned that challenge into some form of power to resist the friction for myself and others to come. And it just takes courage, and it takes, I say this now, it's not about how long it takes, but it is this decision. So we are all one decision away from a better future, not just for all humanity at large, for other needs and other issues, but I believe for the trans community. And as we continue to make decisions to decide, like, okay, I'm going to show up today on this call, or I'm going to type in this call, I'm going to engage. When we show up and make those decisions, what we're doing is we're creating a level of consciousness. It's like a cloud, a conscious cloud over ourselves and over our community and over our country and over the world that is going to continue to expand. And in due time, certain conversations we won't have anymore. So I'm just very thankful to be a part and to help create this new cloud of consciousness that says, you know, people have rights at the basic level, at the human level, from which we all are human. We are not all separate species. We are all one human race. And so, yes, I'm just very thankful. So thank you. And yeah. So
I appreciate you so much. Thank you. I really appreciate just being taken. Sometimes some of our conversations are just so intellectual and head heavy, and you've really helped us to connect the head and heart. I just appreciate that so much. There is not much else I can say. I think the panelists have said it all. I just want to close by just acknowledging also, because Robert mentioned it, the sort of the through line around racial equity and the disproportionate impact of so many things, particularly within the LGBTQ community on communities of color. And so we cannot not acknowledge, you know, all of these intersectionalities and how we are, how much work we have to do to really unbundle and dismantle them all. I want to close by reverting back to the just with a couple of things. One, again, thank you to all of our panelists and for all of those of you who decided to join us. I really appreciate your engagement. It's why these social justice town halls are so important. I want to invite you all to our On the Table that's coming up on October 1st. It's a powerful community listening and civic engagement holiday, as we're calling it, where we're bringing together people from across the region in virtual and small group conversations across the region, so that we can really look at ways to continue these conversations, but also come up with some solutions with and offer micro grants toward responding in meaningful ways. You can learn more about VoicesDMV on the Table at voicesdmv.org. I want to thank Ben and the entire Community Foundation team for pulling this important conversation together. Really, really appreciate the work that you all do, both in front of important audiences and also behind the scenes. If you want to learn more about the Community Foundation's work and support us through your giving, I want to direct you or highlight the LGBTQ fund that we have at the Community Foundation, and Ben Murphy can be contacted to learn more. Our next Social Justice Town Hall is on October 15th at noon, where we will talk about food security and equity. Again, thank you all for joining us, and we really, really appreciate your time, attention, and commitment to this important work. Take care, everyone. Thank you.